Hello, this is Melanie Funches from the Mental Health Association, and I wanted to come to you today to give honor and pay tribute to a member of the mental health wellness community that has passed on. Many of you may not know Amy Blue's name, but many of you do know her work. Amy was the founder of the Semicolon Project. It was a suicide awareness project that asked people to draw semicolons on their body as a representation of taking a pause. In literature, when writing, when a writer uses a semicolon in a sentence, that means that they want the reader to take a pause. It means that their thought is not over, but they want the reader to take a pause and then finish the thought. Much like in writing, in life, there's times when things are hard and you may just want to take a pause. So the Semicolon Project said, take that time, take a pause. Don't use a period. Do not end your life, but just take a pause and then take a break, come back, and finish your sentence. So in honor of Amy, we are coming together to talk about suicide and bring up some more awareness and to talk to you about some myths and what you can do to help. The first myth that I want to dispel in this time is talking about suicide does not make people want to commit suicide. People may say, well, if someone's thinking about suicide, if you talk to them about it, that they'll want to do it. That is not true. The data does not bear that out. More so than anything, the best thing you can do when you think someone may be contemplating suicide is ask them. You can ask them directly, are you thinking about hurting yourself? Are you thinking about suicide? And in doing that, you can open up a conversation with them and begin to help them to see why that they can't be replaced, why they need to stay. Another myth that we want to talk about is sometimes people believe that suicide attempts are manipulative behavior or a way to get attention. What I would say is that no, people do not use suicide attempts as a way to get attention. And something that you can do to help someone who is contemplating suicide is to listen to them openly without judgment. Sometimes we look at problems that one person is facing or another person is facing and say, oh, that's not that bad. And sometimes without intending to, we minimize what people are going through. Each person's journey, each person's struggles are their own. So something that may not be that big a deal to me or even to you may be huge to someone else. And something that's not huge to them may be monumental to us. So we need to be able to stand with and be present with each person as they go through what they see as their challenge. Also, something that you can do to help is to take every threat seriously. Sometimes people will think about this and they may not go through, but we need to take them seriously when they say this. Sometimes you will hear people say, oh, they don't mean it. But you don't know what is going through that person's mind. So when someone says that they are contemplating suicide, take them seriously. And you don't have to do this alone. Another thing you could do is employ the help of friends. If you hear that someone you know is doing this and you have a circle of friends, employ the friends. One of the things about suicide that makes suicide able to thrive and be pervasive is that people keep it a secret because of shame, because of any number of reasons. We keep this a secret and we don't talk about it. But if we involve friends and we bring it out into the open, we can make more people aware and potentially we can make it so that we can save lives. We have resources that can help. If you want to know more, go to our website, MHA Rochester/suicide, and there you will find resources, you'll find phone numbers, you'll find all links and things that can help you to understand more about suicide and potentially be able to help someone. And we'll also, underneath this post, we will have resources and phone numbers that you can link to as well. Thank you so much. Again, this is Melanie Funches from the Mental Health Association. Have a good day.